Hello there. My name is Evan Ogden. I'm doing a educational video for a couple medications regarding extrapyramidal side effects. So you're going to see these side effects with a lot of psychotropic medications, antipsychotics, a lot of medications you're going to see in psych. So we went over a patient for our presentation who was an 18-year-old, and he was presenting with classic EPS symptoms. So there are four stages of EPS from acute to long term. So like the longer you see it, the higher the chances are for irreversibility. So it starts with akathisia, which is symptoms like restlessness, feeling the urge to move, inability to sit still, and then it goes to tardive dyskinesia, which is things like abnormal or involuntary muscle movements. In our patient scenario, it was a clenched jaw, um, and ulnar deviation, involuntary to the right side. Sorry, nuchal deviation. Um, this is based off a real life scenario. The patient was taking Zyprexa, um, scheduled, as well as PRNs for anxiety or agitation. Um, Obviously, it differs in the patient, but you need to watch out for these signs and symptoms. So, he presented with muscle stiffness, agitation, anxiety, involuntary jaw movements, and jaw rigidity. Um, so the medications we prescribe to reverse these effects of extrapyramidal side effects are an immediate dose of Benadryl IM, and then you're going to place the patient on a scheduled prescription for Cogentin daily. Um, And then as for his medication regimen, it's just to decrease the antipsychotics and possible medications that induced the EPS. So in his case, it was Zyprexa and Klonopin. So um, you're just going to want to prescribe or lower the dose based on what caused his EPS and to make sure that the Benadryl and Cogentin reverse the EPS for patient comfort. So first medication would be Cogentin 1 milligram PO, and that's once a day for 30 days. With this medication, it's specifically aimed at prevention of EPS or helping reverse it a little bit, mostly Benadryl, but yeah. As far as medication contraindications, you're going to want to avoid alcohol. Um, as with most medications, it can cause drowsiness, dizziness, um, and then it can also cause hypertension exacerbation. As far as our second medication, we have Zyprexa. So obviously, it induced the EPS, but a patient who still needs Zyprexa, you're just going to need to lower the dose. So I think he was on 10 milligrams. So we were going to um, 10 milligrams twice a day. So we're going to lower the dose to Zyprexa 5 milligrams PO BID twice a day. And just like most medications, Zyprexa has some food and supplement interactions. So the big thing to avoid is grapefruits or grapefruit juice because it can cause potentially dangerous side effects and it can change the availability of the drug. Additionally, you're going to want to avoid alcohol. Zyprexa can make you drowsy, and alcohol interacting with that can also make you additionally drowsy. It can cause you to be more sleepy, change your sleep cycle, make you unable to drive, things like that. And then the last thing, this patient had a lot of anxiety, so he was also on Klonopins. So Klonopin probably also led to the extrapyramidal side effects. Um, but for a psych patient who requires or finds a necessity or a need for Klonopin, we're just going to lower the dose and monitor for progression of EPS symptoms. So with the Cogentin, we're going to hope, well, with the Benadryl, we're going to hope that that reverses the EPS, and then the Cogentin is going to be EPS prevention long term, and then the Klonopin was at 1 milligram by mouth PRN. I think it was Q4. So we're going to change that Klonopin 0.5 milligrams PRN once a day. If needed, maybe change that to twice a day based on anxiety levels, but at least to monitor EPS for now, that's what we would change. As far as interactions, Klonopin is a benzodiazepine, so it is going to cause some drowsiness. You're going to want to avoid alcohol, just like most medications. For our topic today, this EPS is mostly found in psych patients, but I guess I directly want to target this educational video to not adolescents, young adults. So anyone in the age of 18 to 24. As the world has grown towards mental health issues and making that more of a, not put on the back burner, but a primary issue, we're seeing a lot more people in this population in psych facilities and with psychiatric issues. From it could range from anything, but one of the biggest complaints or issues is anxiety that comes along with this, that can't just be relieved with breathing treatments or CBT. Sometimes it needs pharmacological interventions. So for persons 18 to 24, taking any sort of antipsychotic medications, taking any sort of anxiety medications, benzodiazepines, antidepressants, tricyclic antidepressants, any sort of psychotropic medications, we want to inform this population that this is a possibility. And although, you could be taking medications for your anxiety, the induction of EPS can cause a greater amount of anxiety. So it's not good for treatment. It doesn't help anyone with treatment. It doesn't help anyone. So informing this population that if you do see these signs, and they do range in intensity, and yeah, but if you see these signs, you're going to want to notice them, and you're going to want to talk to a provider. You're going to want to endorse this to your nurse or the doctor so they can take care of it and fix the main problem of your treatment, whether that's anxiety or any sort of psych issues that go on. So yeah, those are the three medications. We have Cogentin 1 milligram, we have Zyprexa 5 milligrams twice a day, and Klonopins as needed 0.5 milligrams. I think that is going to conclude my video. I hope you learned something. Thank you.